I'm so glad that you guys could join us, and I'm glad that everyone else here also can join us virtually. But I can introduce myself. I'm the Program and Education Manager in the Ventura County office of the Alzheimer's Association. So our chapter serves Ventura, Santa Barbara, and San Luis Obispo counties. And my name is Leila Thayer Malone. I hope that you guys will see me a lot in the community in the coming year. And hopefully, eventually, my entire face would be nice. But for now, as we were talking about, Los Angeles has gone back to being masks indoors and everything. The Delta variant is spreading around, so it's very, very good to be careful. Hi, grab a seat anywhere you like. There's some tables over there, there's some over there, wherever you like. Just as long as you can, hopefully everybody can see the screen with the presentation.
And I can take you with me. How are you? Yes. Yourself and you can watch some TV and do some fun stuff. Okay.
All right. All right, so as I said, we're going to talk about dementia-related behaviors today, and how you as care partners and people who have a loved one with dementia, how you can better respond to these behaviors in a way that both lowers the frustration that you might experience and also the person with dementia lower their frustration as well. There are some specific techniques that we're going to talk about in this presentation that you can hopefully apply to lots of different types of behavioral issues that you might see displayed in your person with dementia. So Ronnie, if we could hit the next slide. Thank you. So our objectives today are really, really simple. It's just, this is going to be about a 45 minute presentation. We're just going to give an overview of how you can address some of these behaviors. We'll definitely have time for questions and answers afterwards. So if you have anything specific you'd like to discuss, I'm definitely here for you. So we're going to identify some common triggers for behaviors. What are the things that commonly cause behavioral problems in a person with dementia? Everybody who has dementia is experiencing it in a different way, but there are some commonalities throughout each patient. Then we're going to explain the process for assessing and identifying these challenging behaviors. So how do you identify them? How do you kind of identify when they occur? What are the things that are happening around the person? Things that you can maybe anticipate and hopefully build an environment for the person that is less triggering for them, that doesn't trigger these behaviors. And then we're going to list some strategies to address some of these common behaviors. What do you do in the moment? What do you do? How do you talk to your family about building this environment that is better for the person with dementia and better for you as a caregiver? So we're going to talk about all of that, and we'll use a simple 4-step method that I'll get into in a second. So some of these difficult behaviors, some of the most difficult behaviors are going to occur in the person when they're in the middle stage of the disease. And at the Alzheimer's Association, we like to just keep our descriptions of the stages very general. And the reason that we do that is because there are symptoms that somebody is experiencing that might normally be late stage symptoms, but maybe they were just diagnosed 6 months ago. Or somebody will maybe float in between some symptoms. They'll have bad days, they'll have good days. So we like to keep it very general. So we just talk about early stage, which is generally high functioning. The person can live independently fairly well. And then there's middle stage, which is when the person begins to need more and more assistance, when their cognitive problems become much more pronounced, when it's fairly obvious that they have a cognitive problem, and it's more difficult to hide. And then there's a late stage when the person maybe is bedridden or they are unable to communicate anymore, especially verbally, and potentially even without being able to communicate through their behaviors. But in the middle stage of the disease, that's when most of these problems with behavior arise, is when they're in that stage where it's very clear that they have a cognitive problem, and the family has definitely noticed, they've probably gotten diagnosed. Most people get diagnosed when they're in the middle stage rather than when they're in the early stage. And that's because lots of reasons for why that might be. So it's important to know, though, that these behavioral symptoms are often caused by things that are really simple. They're often caused by physical symptoms, that the person is no longer able to communicate verbally to their caregiver. So maybe they have a urinary tract infection and it really hurts to urinate. So then that might manifest itself as the person flat out refusing to use the restroom. And never being able to tell the caregiver why they're refusing to use the restroom. But that's a behavioral problem, and it's a way that the person is using their behavior to communicate that they are in physical pain. So as the people who are not cognitively impaired, we need to be the ones who are able to look at that behavior and examine it and be detectives and figure out what is the underlying cause of that behavior. So that's really what this entire method is going to be about. So behavioral symptoms can also be triggered by overstimulation. If there's too much going on, a person with dementia has a really difficult time focusing. So if they're being asked to do too many things at once, that can be really overstimulating for them. And then they can act out with behavioral communication. Can also be due to sadness and loss, especially in this last year. If we've lost anyone during this year, it can be really difficult to, the grieving process was just completely different this year because they weren't able to go to funerals, we weren't able to have the type of closure, and for a person with dementia, it can be especially difficult for them. So behavioral problems might be caused by that. It might be caused by boredom, by isolation. Lord knows we all experienced that this past year. Lots of boredom, lots of isolation this past year. So if you're caring for a loved one with dementia and you've noticed that their behavior has gotten worse in the last year, it very well may be because they are simply bored and they've been isolated from the people that they love, and it's difficult for us to get out due to, obviously the safety of it. So all of those things can cause these distressing behavioral symptoms. Things like, and just to put a name to what we're talking about, things like aggression, things like repetition, repeating questions over and over again. Wandering is another behavioral symptom. Things like that are really common for a person with dementia to experience. So today we're going to talk about a 4-step method that we can use to apply to most behaviors. I won't say all, but I'll say most behaviors we can apply this. So number 1 is going to be detect and connect, right? So just detect what the behavior is. Notice when the person is having a behavioral problem. As the loved ones of a person with dementia, you know them the best, so you can tell when their behavior is off. And then you're going to connect with them by joining their reality. Because that's another really key part of dementia, is that that person is now existing in a reality that is different from ours. Because our reality is really, it's largely based on how we perceive the world. And now the way that they are perceiving the world is significantly different than how we perceive it. So detect and connect is going to be our first step there. And then the second step is going to be addressing physical needs. And the reason for that, again, is going back to things like urinary tract infection. A person with dementia is going to have difficulty expressing that. They're even going to have difficulty expressing where on their body they are in pain. Why they're in pain is definitely going to be difficult. So it's up to the caregiver to, if you notice a sudden change in their behavior, take them to the doctor, have them look them over and make sure that there isn't anything physically going on. And then next is going to be addressing their emotional needs. So are they feeling scared? Oftentimes that is why these behaviors come about. They're feeling anxious, they're confused, they become agitated because of that. So addressing those emotional needs is going to be another key step. And then of course there is reassess and plan for next time. Because guess what? It's going to happen all the time. Unfortunately, a person with dementia is not really able to learn new skills. It's just the nature of the disease. So no matter how many times you play this game with them, if they've got a behavior, you address the behavior perfectly well, they calm down and the behavior stops. The next day, you might be right back doing it again. So it's important at the end of when you try these strategies to assess how you did and see what worked and see what didn't, and to plan for next time, and say, well, next time that this happens, because I know it's going to happen again, next time that it happens, I'll try this instead and see if that works. And then you repeat the process. All right, so detect and connect. All right, so this is going to be your first step in dealing with a behavior problem. And it's really a difficult thing for a lot of caregivers to understand, is that the person with dementia they really truly are existing in a different reality. The way that they are perceiving information coming at them is completely different than the way a person without a cognitive impairment is perceiving that. So behavior is a form of communication. We all use our bodies to communicate. We all use things like tone of voice and other nonverbal cues to communicate. So communication is a lot more than just the words that you're using. It's all about how you're acting, what tone of voice you're using. So a person with dementia, as they lose their ability to use language, spoken language, they're going to start to use their behaviors more and more to communicate. So if you understand, number one, that behavior is a form of communication, and number two, that behavior that person is exhibiting is actually very reasonable for the reality that they are existing in, right? So if you can imagine joining their reality, their behavior suddenly becomes a lot more reasonable. Because if you were existing in a reality where you have pain, but you're not able to express that pain, and you got mad about that, that would be very reasonable for you to do something like throw something across the room or something like that. So joining their world is really key to decoding what they are trying to express to us. So a lot of times you're not going to be able to figure out where the behavior is coming from or what the person is trying to communicate through the behavior just by talking to them or by asking them. But we really have to put ourselves into their shoes and say, okay, what are they going through right now? What else is happening around them? Are they overwhelmed? Are they overstimulated? Are they understimulated? Are they in physical pain? Things like that. So start to do some detective work. Figure out who was present at the time of the behavior, right? Are there any people in there that might have contributed to it through things that they said to them or things that they did, or even just who they are? What happened just before the behavior began? Was there some sort of precipitating event? Did something happen right before? What about the day before, or even just right before the behavior begins? Where did it take place? What was the person seeing? What were they hearing? What were they touching? That's all going to be important in detecting and then connecting to them and joining their reality. When does the behavior tend to occur? And this is really important if it's a recurring behavior. If it's something where it's like, at 4 p.m. every day, mom gets up and tries to leave the house and go on a walk. That's really important. There might be a really good reason for why it's occurring at 4 p.m. You've all heard of sundowners, right? Sundowners is one of those sort of mysterious symptoms of dementia that's really common, where right around sunset, right around dusk, the person will become more agitated and more confused. Very unclear why. There's lots of different reasons, lots of different theories for why that happens. It could be because that's the time of the day when it's unclear if it's morning or if it's night. Am I supposed to be getting out of bed? Should I have been in bed these past hours? Or am I supposed to be getting ready for bed now? That can get confusing for the person. And then another really important thing to examine is, how did you react to them? Did you validate their feelings and join their reality and acknowledge that what they are experiencing is real to them? Or did you tell them, you're wrong, what you're feeling is wrong, and you shouldn't be acting this way? Because that's going to be a really key thing, is never argue with a person with dementia. It's a very bad idea. Nobody wins, literally nobody wins in an argument with a person with dementia. What they are experiencing is very real to them. And it doesn't matter if it's not actually happening in our reality, because they're not in our reality anymore. And to try to grab them and pull them back into our reality is just kind of cruel in a lot of ways. It's very, if you've ever experienced being gaslighted, right? We're all women here, probably have. You say something, you say what you've experienced, and somebody says, no, that didn't happen. That's what a person with dementia gets every single day, is the things that they are experiencing are not real. So it's very important as the caregiver to be aware of that, and to be aware of how harmful that is to the person's psychology. So next we're going to address the physical needs, and this honestly is probably the simplest part, right? Because physical needs are very concrete. They're very, oftentimes they're easy to detect. You can look for any signs of a recent injury. Did they fall down in the garden and skin their knee and you didn't know about it, and now they're refusing to get up out of the chair because their knee hurts? Maybe that's why. Do they have a urinary tract infection? I've mentioned UTIs 3 times in this presentation because I can't tell you how common it is for a person with dementia to have a UTI that is left undiagnosed because they are not able to verbally say, it hurts when I urinate. A lot of times they're not even really able to perceive that signal of pain that they have, and the UTIs can be very dangerous. So be really, really aware of that. Make sure that there's no other underlying infections. Take them to the doctor if you see any sudden changes in their behavior. You can also look to see if it's a reaction to a new medication. So really, anytime that there is a sudden change in behavior, you're going to want to take that person to the doctor, because behavioral symptoms are oftentimes a result of some medical problem, right? Whether it's an underlying infection, some sort of pain due to an injury, or a change in their medication that just isn't working for them. So no matter what it is, if there's a sudden change in behavior, really recommended to take them to their doctor and to explain the behavior. Take notes on the behavior so that you can really explain it when you're in the doctor's office, and just have them check it all out. And then there's also other physical needs that are not so much within their body, but physical things that are happening in their environment. So for instance, a lot of times a person with dementia will not be able to recognize their own reflection in a mirror. It might scare them because in their brains, maybe they are 35 years old and they're young because that's where their memories are at. But when they see themselves in the mirror, suddenly they're an elderly person. It can be very jarring for them. That's just an example of why it might be distressing for them. That's not necessarily the reason. But that's an example of an environmental change that you can make as the caregiver, covering up the mirrors. Making sure that there aren't too many of them around, and that can help them to calm down and not have that trigger in their environment. That goes back to the detecting part of what was happening when the behavior occurred. Were they fine on this end of the hallway, and then they walk past a mirror and now they're having a behavior on this side of the hallway? It can be as simple as that. So we're going to address the emotional needs next. So think about how the situation feels to the person, because this is going to be the basis of their behavioral reactions. So how is this situation making them feel? You absolutely want to validate their feelings. Do not argue with them. Even if they are accusing you of something, it's very, very common for one of the behaviors to be the person with dementia loses their wallet or their purse, and now they're accusing their loved one of stealing that item. That can be extremely distressing for the caregiver. But it's important to take a breath. We have a phrase at the Alzheimer Association, Q-tip, quit taking it personally. It's good to just breathe and say Q-tip to yourself, and just acknowledge that they're not accusing you because they think, because they don't trust you. They're accusing you because they have a disease that is causing their cognition to not function the way that it should. So in that situation, you can address their emotional needs that's below that accusation, which is, I feel insecure. Because how do we feel when we lose our important items? We feel at the very root of it, it's insecurity, right? It's fear, it's anxiety, it's insecurity, because our important things are gone. So that's when you can address those emotional needs to let them know that you are there for them, that you understand how they're feeling, and that you are there to bring them back to that feeling of security and that feeling of safety. And the way that you can do that in that specific situation is to, let's say they say, you stole my purse. You can respond not by saying, no, I didn't steal your purse, even if that's the truth. You can respond by saying something like, I understand how it feels to not have your important things. I'm so sorry about that. Let me help you look for it. We're going to find it. I am here to help you find it. And that will really validate their feelings. It establishes that you are there to help them rather than to gaslight them and say what they're experiencing isn't real. And then you can address their emotional needs, which really is that they feel alone, they feel isolated, they feel insecure, they feel unsafe, and they feel anxious. So looking at those emotional needs. So you might not understand the exact reasoning behind their behavior, but you can probably figure out and take a good guess at what the emotion behind the behavior is. And 9 times out of 10, honestly, it's insecurity, it's anxiety. So just letting them know that you are there for them and that you are the one who is going to help them get past this, that can be hugely comforting for a person with dementia. But you have to do it in a way that is validating for their feelings, right? So focusing on the feelings rather than the facts that are in that situation. All right, so the final step in this process is to ask yourself, did that help? Did that work? Did what I do have any difference to their behavior? Did it actually successfully calm them down? Did it make them feel better? Did it make me feel better? Was it a better way to handle the situation than what I had been doing before? So, just going back through it, think about all those steps. Did you detect and connect, right? Did you join their reality successfully? How does the situation look now to the person with dementia? How did your reaction to them change their perception of what was going on? Do you need to explore other potential causes and solutions, and what can you do differently next time? So once you've settled on these interventions that are effective, you can recognize that this type of issue is definitely going to happen again. Just because you solved it that one time, unfortunately, because of what dementia is. These behaviors, especially if they've already been a recurring event, they're probably going to continue to recur. But each time you can improve how you respond to it if you take this 4th step and say, I'm going to sit down, I'm going to think about it, maybe journal about it, write it down in a notebook and say, this is what I tried. This is how I communicated with them, and did it work? Did it not work? So these steps, they really can be applied to really any behavior that you see. We're going to go through some examples of some behaviors in the next slides, some really common ones. But just remember that understanding the feeling behind the behavior is really important. Understanding that it's not personal, that your loved one does not love you any less, even if they're accusing you of things and saying things to you that are really, really mean. A lot of times, especially if it's a spouse or a parent and you've been in their lives for decades. My husband and I always say that we have each other's self-destruct buttons in our brains. It's mutually assured destruction, right? When you have a close relationship with somebody, you know exactly what to say to completely break them down. And unfortunately, a person with dementia a lot of times will lose their filter. They'll lose the ability to hold that back because they don't want to hurt you, but the disease sometimes causes them to. But it's really, really important that we as caregivers and as people who do not have a cognitive impairment, that we understand that that person isn't doing it to hurt us. They're doing it because they have a disease that is causing them to lose their ability to hold that back. So just understanding that it's not personal and that there are other emotions and other feelings below those behaviors that you can address as the caregiver. And there's also potentially physical problems as well that are below those behaviors that can absolutely be addressed. For instance, if they're in any physical pain, if you are able to get rid of that physical pain for them, if you're able to take them to the doctor and it turns out they have a bad UTI, here's some antibiotics, clears up in a few days, and now they feel better, that's huge. Obviously because of dementia, they're not going to remember that you did all of that for them, but it can help improve your caregiving situation quite a lot. You won't be dealing with a person who's in pain anymore. All right, so how do we apply these steps to some specific situations? All right, so confusion or suspicion. How many of you guys have experienced this with your loved ones? Of them being really, really confused about a situation, or if they're suspicious of a loved one, right? They say, or even suspicious of a stranger, or suspicious of a person who doesn't exist. Especially if your person has dementia with Lewy bodies, you might experience this a lot more. That particular form of dementia comes along with a lot of paranoia and a lot of hallucinations, so it can be especially difficult. So we're going to just use a little vignette, a little story that might make sense to a lot of you guys, or maybe it's something that you've never had, but we're going to talk about Anne, who is this lady here. And when Anne's family comes to visit and the evening begins, she becomes very suspicious that people are trying to get into her house and are watching her through her big picture windows that she has in the living room. She becomes suspicious of her family for not making the people go away, and that they all must be in cahoots with each other. So does anybody who's here in person or on Zoom, you can put it in the chat, Rodney will read it out. Does anybody have any ideas of how you might address this? What's the first step? Right, yeah, and how do you do that with this? So you've got, yeah. Yeah, perfect. So for everyone else, what she said was validating their feelings and just letting them know that you understand how they're feeling and that you're there to help, right? So let's figure this out together, right? Yeah, that's exactly right? So just detecting the emotions and connecting to it, right? Because if you have somebody who is suspicious and who is accusing you of being in cahoots with all these people who are trying to get into my house, you might initially think that the emotion there is anger or it's paranoia or something like that. But really when you dig down into it, it's anxiety. It's being confused. It's not understanding what's going on. So what else can we do to detect what's happening here? So in the story it says that this happens when evening begins and when the family visits. So we can assume that normally Anne is living just with her husband and maybe doesn't always have the big picture windows open. So what happens when the whole family is in the room and it's night and there's big picture windows in the living room? Yeah, with the curtains open. What do you think might be happening there?
You feel like they're in a familiar environment or surroundings?
Yeah, but it's her home though, right? So she's pretty familiar in there. She's pretty comfy in there. But there's not usually that many people in there, right?
Overstimulation.
Yeah, it might be a little bit of overstimulation, right? But you know what the other thing is though? Yeah?
Out of the routine.
Out of their routine, okay.
Usually toward the evening, they probably close the curtains because everybody's there.
Yeah.
They still have the curtains open.
Yeah. And guess what glass tends to do? It tends to reflect, right? And a person with dementia might see that reflection and think that there are people outside of their home. So that is one of those environmental things where we would never consider that. I'm not surprised that none of you thought about that. The only reason I thought about it is because it's written on the page. It's not something that we normally think about, right? That, you know, if we have our curtains open, it's nighttime, so it's light inside, it's dark outside. That creates a situation where you get a reflection. If you normally don't have very many people in the house, that might be a reflection of just, you know, Anne and her husband. But when the family visits, it's 10 or 15 people. And to Anne, she sees that reflection and she thinks, oh my God, what are all those people doing outside my house? They must be trying to get in. Why are you guys not concerned about this? There's people who are trying to get into my house, right? So a really simple solution to this is what? Ooh, Rodney getting in on it too. Yeah, draw the blinds, right? Yeah, this is a way that you can adjust the environment to fit with the person's new perception and their new reality, where reflections are difficult to understand, right? So yeah, just when you have the family over, close the blinds. No more reflection, no more problem, right? So you can address it that way. That's just addressing a physical need, right? That's addressing an environmental thing, right? Something that is in their environment that is causing them to be scared. And then you can also simultaneously do what you said, which is addressing their emotional needs as well by just letting them know, hey, we're gonna figure this out together, you know? You could even do something like take them outside, you know, hold their hand, hold their arm, say, you're safe with me, we're gonna go talk to these people, take them outside, and then the people aren't there, and you say, they must have gone away, I'm so sorry. And while you're out there, have the other family members close the blinds. She comes back in, doesn't see the reflection, no problem, right? So thinking about these things creatively, thinking outside the box, thinking about how they are perceiving things rather than how you would perceive things, right? Because they are not in the same reality. They don't have the same powers of perception that somebody without cognitive problems has, right? Aggression. All right, hold on, let me get the vignette here. All right, so now we're gonna switch to Bill, right? So Bill is married to a woman who is conveniently also named Anne in this vignette. So Anne's husband, Bill, is standing at the back of the room, leaning against the wall with his arms crossed, watching television, right? So he's just kind of chilling out in the living room, just standing like this a little bit and watching TV from across the room. Oh, this is the same person, Anne. These vignettes always trip me up. So Anne, the person with dementia, walks in and tells him very sharply, you aren't the boss here. And Bill ignores the comment and he continues to watch television. Anne comes closer, raises her voice and says, you can't tell me what to do. When Bill doesn't respond, Anne comes up to Bill and hits him on the arm with her balled fist. Prior to her dementia symptoms, Anne was very calm by nature and would never have exhibited this behavior. Lately, her outbursts are becoming more and more frequent. She continues to come at Bill, who retreats from her and locks himself in the bathroom to avoid further contact. He does not have a cell phone with him since both had been avid hunters when they were younger. There are guns in the house, but Bill has removed all the ammunition. What are the myriad things that we can see that are wrong with this situation, first of all? What should Bill do? How should Bill address this? Because this is a repeated thing that keeps happening, right? Let's think first, what do we think triggered that behavior?
Being ignored, not validated.
She's being ignored? Yeah. Yeah, that's actually, yeah, that could be it, yeah. Because Bill is just, standing there watching TV, right? But what does a person look like when they've got their arms crossed? They look what?
They look reserved, upset.
Yeah. Somebody kind of looks upset when they're like this, right? My college boyfriend told me that I looked pissed off when I was crossing my arms. So I've habitually crossed them behind my back now. The little things we learn in life. You're giving a signal to the person with dementia through your body language that you might not even realize you're sending. You don't even realize that you're sending the message, but when you're standing with your arms crossed, you look a little bit pissed off, a little bit upset, right? That's kind of what humans do when we're a little bit mad, when we've given up on something and we're just like, ugh, I'm pissed. You cross your arms. So Anne, even though that's not what Bill is doing, because we also cross our arms when we're just relaxing and when we're just standing, but Anne isn't able to see it that way anymore. She takes the message that Bill is trying to be the big boss, right? He's trying to tell her what to do. He's trying to be in control of things. He's pissed off at her for some reason and she doesn't understand why. And also in addition to that, it's her husband and he's been locking himself in the bathroom to avoid her, right? So she's getting ignored, her feelings aren't getting validated, and none of her issues are getting addressed, right? He's not addressing any of those emotional concerns that he has. So there's all of that stuff, right? Watching your body language, making sure that the signals that you're trying to send to the person are not getting misinterpreted because it's ripe for misinterpretation, right? So ruling out medical causes, again, this is something that is getting worse, right? So it's something that Bill has seen and do more and more frequently, right? So addressing medical issues is going to be a really, really important thing to do here. Anytime, again, that you see a sudden change in their behavior, or if you see something that is progressively getting worse and worse and worse, take them to the doctor, address those physical needs first, and then look at their emotional needs and figure out why she would react that way. The other thing that is in this vignette is that they have guns in their house. And Bill removed the ammunition, so that's good. That's a good first step. But it's really advisable to remove all weapons from the house if you have a person with dementia. And the reason for that is because if they have a behavioral instance where they are, really angry about something, or they're really paranoid, they're really scared, they're going after those people who are outside their house, even if they pick up an unloaded gun, a police officer who comes to respond to that is not going to know that that gun isn't loaded. So that could turn into a really, really tragic situation. So just be very aware of that if you do have guns in your home. It's a very, very good idea to remove those as soon as you can. So, like I was saying, if they accuse you of stealing their purse or things like that, just validating their feelings and just saying, I am so sorry that has happened. Because that's, it's really difficult for us to apologize for things that we know for a fact we did not do. Unfortunately, when you are dealing with a person with dementia, you might find that you actually kind of have to do that fairly regularly. So apologizing to them, validating that they feel that way, acknowledging that their item is, for them, their item is gone. It hasn't been stolen, they've just probably misplaced it, but for them it is gone and they don't know what's happened to it. So you can acknowledge that and just say, I'm so sorry about that. I think I placed it in a weird spot. can't remember where, let's go and look for it really quick. And then you do, look around the house and voila, there it is. That turns out they put it in the refrigerator or something like that. For infidelity, infidelity is a little bit of a trickier one, but there's a lot of things that might be going on, especially within a relationship, that could cause the person to accuse their partner of being unfaithful. And really, again, it's about digging below the accusation, right? Not taking it personally so that you can dig below it and really objectively look at it and say, what is this person feeling that is making them feel like I'm being unfaithful to them? Usually what it is that they're feeling ignored, like you were saying before. Because the fact of the matter is that when the person has a disease, and you're in a relationship with them, you might start to feel a little bit disconnected from them. Reconnecting with them through physical touch can be really, really important. So if you have a routine where maybe you watch a movie together every night, instead of sitting in separate chairs while you're doing that, sit together on the couch. Or go behind them and give them a light massage or something like that. Something that makes them feel physically connected to you can really help to lessen their feelings of insecurity and anxiety about the status of their relationship with you. Because really, when someone accuses you of infidelity, that's what it is. They are feeling insecure in the relationship. They don't know what the status of the relationship is. They're feeling confused about it. So reestablishing that it is secure, that you are there for them, that can be hugely helpful. Starting a new routine where you take a walk with them around the block and hold hands with them, doing something romantic like that can go a long way. And no, they're not going to remember it the next day. If you bought them flowers, they'll thank you in the moment probably, but they're not going to remember the next day where they came from. That's okay. It doesn't matter. The thing about one of the huge silver linings of being with a person who has dementia is that you are forced to live right in that present moment. Nothing in the past matters. Nothing in the future exists. It's all about that present moment. If you made them smile in that present moment, that is a huge win. And it doesn't matter if they don't remember smiling the next day. It's all about that present moment. So again, just trying some new things. Trying to. I'm not sure if things have changed with your routines. How much you're holding his hand, giving him hugs, spending time with him. Things like that can really help. And then in those moments, you can take those questions and why are you wearing makeup? Why are you dressed up so nice? You can kind of turn it around on him and say, thank you for noticing. I did this for you. I was hoping that you would notice that I put on some makeup and I got dressed up. I thought you might enjoy having a beautiful wife. Just again, not taking it personally, taking that breath, even though that's a really difficult accusation to have lobbed at you by a loved one, and it is. It's really, really tough. He has dementia. He's not doing it because he doesn't love you. He's doing it because he has a disease. And just not taking it personally and just breathing through that pain that it causes and responding to it in a positive way can go a really long way. I hope that helps. Yeah, that is definitely a tough situation, and really, unfortunately, very common with married couples where one is caring for the other. The next one, repetition. Who's dealing with this in their life? You were just talking about it a little bit. Yeah, so repetition is one of those behaviors that is really, really common and is probably the most frustrating thing that a person with dementia can do. It's extremely frustrating to be asked the same question over and over and over again. It feels a lot when a person asks you multiple times the same thing and you've already answered them. It can be really difficult to keep the frustration out of your response. But the fact of the matter is that even if it's the 10th time that they've asked the question, it's the first time that they are hearing the answer. So if you respond, even when it's the 10th time that you've answered, if you respond by saying, I already told you this, they're not going to understand why you're so mad at them. They're going to say, I just asked that question. Like, that was the first time that I asked it. Why am I getting all this flack now? So it's really important as caregivers and people without cognitive impairment to, again, take the breath and just answer again in as calm of a way as you can possibly muster. All right, but here is another little vignette about Anne, our lovely lady who has dementia. So Anne has recently been concerned about an upcoming visit from her daughter. And though her daughter Katie is not scheduled to visit for another 2 weeks, Anne has begun to repeatedly ask her husband when Katie will arrive. Anne asks several times throughout the day, every single day, and it's begun to wear on Bill. He finds himself answering impatiently or even ignoring Anne's questions. And at the same time, Anne is going into the bathroom much more frequently than she ever has before, about every 10 to 20 minutes. What do we think's going on here? Right. I love the last sentence of this vignette because it really hammers home everything that I've been saying. It's a UTI. Yeah, if she's going to the bathroom more frequently, she probably is experiencing a UTI that she hasn't been able to tell Bill about because she doesn't have the ability to communicate that anymore. So that's definitely a reason. That's a sudden change in behavior, right? She maybe hasn't had problems with repetition before, but now she's having problems with repetition and she's using the restroom way more frequently than normal. So when you put those two things together, a behavior change and using the restroom more, which is a symptom of a UTI, take her to the doctor, get that UTI treated, and that will probably improve things. It certainly will be good for her health as well too, because UTI is very dangerous. But really the things to do are, first of all, detecting and connecting, right? Staying calm, be patient, take a breath. I really recommend meditating. It's a very fantastic way to lower anxiety. Yeah, you can. Yeah. I take it that's your technique. Yeah, just walking away. You can, if they're still able to read, if they're a lot of time, a person with dementia, as they advance, they won't be able to understand written language anymore. But if they are at that level where they can still read, having a whiteboard in the kitchen, maybe with the plans or with the answer to the very common question, and then instead of repeating the answer, you can just point at the board. You could write it down into a notebook. I had a client whose mother had a notebook that she kept with her all the time, and they actually made like a little wrist bracelet for her so that she would keep it all the time, and it had all of the answers to the questions that she asked because she would write them down.
Board, how many times she asked the same question? The board that I use, if I can understand me, I write it on a board.
Oh, really?
So if I write down every time that he asks many times, will that help?
You could try. Honestly, give it a shot. See if that helps. See if he needs the evidence, right? I mean, if he needs the evidence for it to back you up, then yeah, that could potentially help. Again, go through these steps, and then step 4 is reassessing, right? Planning for next time. So see if that worked. Do it a few times, see if it works. Again, always look for pain, for physical issues first. If it's a sudden behavior change, can't say this enough. If it's something that's getting worse and worse and worse, take them to the doctor, get it checked out. It can be the cause of behavioral changes. But also exploring the physical environment for triggers. Maybe there is, maybe you've told them that, in this situation, Anne's daughter is visiting. Maybe she wouldn't think of Katie as much if the photo of Katie is taken down off the wall until the event comes up, right? So, maybe look for those reminders that might trigger in their brain the thought like, wait, there's something with Katie. What are we doing with Katie next week? And that's the 50th time that she's asked that, right? So if you take that thing out of their environment, then maybe they'll stop repeating. You can really, really utilize the out of sight, out of mind principle with a person with dementia. My dad did the same thing with my step-grandmother who has dementia, and she was constantly calling him to ask, when are you going to fix the car? When are you going to fix the car? When are you going to fix the car? Well, my dad had disconnected the battery, so he was never going to fix the car because he didn't want her to drive anymore. But then he pulled the car out of the driveway, parked it just down the street, just maybe one house away, never asked about it again because she's not looking at it, right? So yeah, same with the computer. If you've got a computer that's broken and the person asks, when are you going to fix it? When are you going to fix it? When are you going to fix it? Just removing the computer from the environment and rearranging things so that it doesn't trigger that memory of theirs, that long-term memory that they have, then that can stop the repetition. Yeah, absolutely. Good job. Yeah, but I mean, repetition is, unfortunately, it's part of the disease, right? So it's, it is a way that the person with dementia is going to try to feel less confused about the things that are going on around them, right? So they're going to try to continually get that information that for some reason in their reality, for some reason this information is continually not available to me, right? Because I've asked this question, but I never seem to get the answer. But of course, you've already given them the answer 50 times, but in their reality, they've never heard the answer to their question. So a lot of times, another thing that you can do to, to lessen the repeating is recognize that a lot of times that behavior comes as a result of them being confused and of them feeling insecure and just generally kind of they don't know what's going on, right? So you can maybe try to, that's why putting a schedule on a board can be helpful, because then they have a touchstone. They have something that they can go back to. They can see that it's, oh, okay, so today is, maybe have a calendar, a large calendar with each event written down on it, so that they have a touchstone to go back. Because right now, if they're repeating questions, you are their touchstone. That's what they're using to reorient themselves into reality. So if you have something that has it written down, or if they're not able to use language anymore, maybe try to use pictures or things like that, that can really help. Also, if they're asking about things that are in the house, like a lot of times a person will ask many times, where's the bathroom? Even though they're in their own home, they will forget where their bathroom is. See you nodding there. Using something to label the restroom can be really helpful, because then they no longer have to ask you where the restroom is. They can look around and see, oh, okay, there's a picture of a toilet. Now I know it's right there. And they might have to do that every single day. They might have to do that every couple of hours. It depends on where they're at in the disease. All right, so Ronnie, next slide. I think we're gonna talk about the walk after this. So, oh yeah, this is a hugely important slide too. And I have my, for everybody here who's in person, I have my business cards if you want to contact me for any of this information. I can send you the slides, anything that you like, anything that you need. We have a tremendous amount of resources available for you. If you are caring for a person with any kind of dementia, and this is another class that we teach, I didn't go over it this time, but dementia is an umbrella term, and there's many diseases that cause dementia. Alzheimer's disease is the most common cause of dementia, but there's also things like dementia with Lewy body, there's vascular dementia, there's frontotemporal dementia, there's dementia as a result of a brain injury. There's many things that cause it. So we are not just here for people with Alzheimer's disease. We're here for anybody with any type of cognitive impairment that is due to any disease. Our website is full of information. We also have our ALS Connected, which is our It's like a message board. It's like an online support network. There's over 50,000 users on it. So if you have questions that you need answered, there's thousands of other caregivers who have dealt with the exact same things. We've already, just in this room with 6 people in it, we've already gotten a lot of tips and a lot of things, a lot of information shared between us. Imagine having access to 50,000 caregivers that have that same experience. We have our 24/7 helpline, which is available to you literally 24 hours a day, 7 days a week, holidays, weekends, 3 o'clock in the morning, and you're not waking someone up. They have to stay awake overnight. You're actually giving them something to do if you call at 2 o'clock in the morning. So we encourage you to do that. There's dementia experts that will answer the phone at any time, day or night. We have our website there for our chapter is alz.org/California Central. And we offer support groups, we offer classes like these, and we offer care consultations as well with our local staff here, who are very well trained, very, very good people. And then you can also always access all of our trainings, all of our education at any time on training.alz.org. They're a little bit more dry. They're recorded PowerPoints. That's literally just the slides and then a voiceover. I recommend that you come to our live presentations, but if our live presentations don't work for your time slots, for your schedules, then absolutely go to training.alz.org. We've got tons of trainings on there for caregivers.